you ever felt dizzy when you stand up off the couch after a long period of time? The answer for most of us is yes. It's a normal physiological response to a slight dip in blood pressure that we all experience when rising from a sitting position. But for some people, the effects are much worse. For people suffering from Postural Orthostatic Tachycardia syndrome, or POTS, they have a much lower blood pressure over a longer period of time, and it's often accompanied by an increased heart rate, or tachycardia, to try to get their blood pressure back up to normal levels. The results of these effects is that they often faint and show fatigue after sitting for a long period of time. POTS is a relatively new disease, and the causes are somewhat unknown. And unfortunately, the majority of POTS patients go undiagnosed or even worse, misdiagnosed. The lab I work for recently published a paper about the autoimmune basis for POTS. And so today I will walk you through the methods we use in that paper, as well as the results and interpretation from our data. To begin with the methods, we'll first discuss the patients we used. We used sera from 14 different patients and then 10 controls in the study. We measured the sera's effect on 3 separate receptors: the beta-1, which is in the heart and causes the heart to beat faster when activated; the beta-2, which causes a dilatory effect in the blood vessels, which lowers blood pressure; and the alpha-1, which is also in the periphery, which causes the blood vessels to constrict and causes blood pressure to rise. We used 2 different ways to test our data. The first was a perfused rat-cremaster arterial assay, which tested for contractility and dilation. Arteries have smooth muscle in them, and the primary way the body regulates blood pressure is by constricting those blood vessels to cause higher blood pressure or dilating them to cause lower blood pressure. We also use a receptor transfected cell-based assay to detect beta-1 and beta-2 and alpha-1 receptors. Basically, all 3 of these receptors are on the surface of cells. We put cells with these receptors, incubated them with sera from the patients, and then we had a way of looking at the cells and seeing if they'd been activated in any way. If they'd been activated, it would tell us that the autoantibodies were active and they did bind to the receptors, and that our hypothesis was on point. I'm going to describe the results and interpretation of our study based on the previously stated methods. As far as the contractile rat arterial assay goes, the sera of all POTS patients showed greater arterial contractility than controls when the dilated beta-2 receptor was knocked out. The contractile effect was also partially blocked by prazosin, which is an alpha-1 receptor antagonist. What this means is that the alpha-1 receptor was activated by the autoantibodies. POTS sera actually also acts as a partial alpha-1 antagonist in the presence of phenylephrine, which will be more important later as we talk about it. And it shifted the curve to the right, showing that it actually had an antagonistic effect toward phenylephrine. Also, POTS sera acted as a partial beta-1 activation, showing a 30% increase from controls and baseline. And also, the POTS patients sera moved isoproterenol cyclic A and P curves to the left, which showed beta-1 receptor and beta-2 receptor activation. I'll now discuss the results of the receptor transfected cell-based assays binding the second study we used. The assay contained beta-1, beta-2, and alpha-1 receptors, and so we showed that all 3 of those were activated in the cells that we incubated with the sera, meaning that all of those were active, and that all the antibodies did occur in the POTS sera. To interpret this data, all of the POTS patients had an elevated AT1 receptor activation in the periphery that was antagonistic, meaning that the alpha-1 receptors, when they're activated out in the periphery, instead of a normal person getting off the couch and having a slight dip in blood pressure, the baroreceptors in the body sense the low blood pressure and activate the sympathetic nervous system, which sends norepinephrine over to the alpha-1 receptors, which constricts the blood vessels and causes blood pressure to rise back up to a normal level. The autoantibodies that were in the POTS sera would block that phenylephrine from constricting the blood vessels all the way. So instead of their blood pressure rising, they still have a slight dip in blood pressure, which caused the baroreceptors to release even more sympathetic hormones, which activated the heart and caused a tachycardia, by causing increased heart rate. So that's how POTS comes about in these patients, we think, from an autoimmune basis. And in conclusion, these findings are very relevant because until now there's not really been any confirmed root cause for POTS. And in reiteration of the main points, we walked through the methods using the two main methods of the Rackmaster arterial perfusion as well as the cell-based assay, and then I discussed the results and interpretations of that data. I hope I've been able to inform you of the autoimmune basis for POTS disease, and the reason it's relevant to you is that many people have POTS that don't know it and that we don't know about, and so keep an eye out for the symptoms of fatigue and fainting in a chronic sitting because we might be able to catch some more of POTS disease. Thank you.